My name is Raj Bhattacharya. I am an orthopedic consultant. I am a specialist in knee surgery. I do both trauma and elective knee surgery. So I grew up in a very medical environment. My father was an orthopedic surgeon. So I grew up looking at x-rays, and I always thought that that's what I needed to be. I looked at knee x-rays from a very young age. So I had the advantage of going into medicine or medical school knowing I wanted to be a knee surgeon. So I did not have to think long and hard to pick up a specialty. So it was slightly easier for me. The thing about orthopedics is there's a level of what I call instant gratification. So you come in, if in trauma you come in with a broken bone, it's painful, I fix it, and the pain gets better and you start walking. So you can see the difference. When you have arthritis, you come in with a lot of pain, we give you a joint replacement, and the pain improves. The number of times people come and tell me that you've changed my life, it makes it all worthwhile. It makes me feel as if I'm making a difference to people. I think that's the biggest thing, is I have provided them with the quality of life that they were hitherto not experiencing. Although I'm a surgeon, I explore all options of treatment for patients. That includes non-operative as well as operative field. So referring to me does not necessarily bring the patient down the route of surgery. So they will get an informed decision-making process. They'll get all the information, and they may or may not require surgery. So I would always explore non-operative treatment options for all patients in all conditions. And patients worry when they come to see a surgeon that they'll be put through a surgery, but that is not necessarily the case.